Eye Health for All is a pilot project launched by Glaucoma UK to raise awareness of glaucoma in African Caribbean communities and also to encourage regular eye testing. Here to tell us more is Robin Asprey, who's the Development Manager and Outreach Services from the Support Services team at Glaucoma UK. I'm also joined by Chuck Wadike, whose own family's lives were affected when his father was diagnosed with glaucoma. So, thanks both of you for joining me. If I could start with yourself, Robin, please tell me a little bit about glaucoma itself.
Hiya, thanks ever so much for having us. So, yeah, glaucoma is a group of eye diseases. It's actually the number one cause of preventable sight loss worldwide. So, it's one that we want to be taking seriously. In glaucoma, there is the thing that all of the different types of glaucoma have in common is that there is damage to the optic nerve. And the optic nerve is the part of the eye, it's at the back of the eye, and it carries the information that we see to our brain. And that damage is usually caused by high pressure inside the eye. So, inside our eye, we've got a fluid that's being made all the time, and we want it to be made and drained out of the eye at the same time. And if that isn't quite working properly, then we tend to get a high pressure inside the eye. That high pressure damages the optic nerve and usually starts to affect the peripheral vision first. So that's the vision around the edges of everything that we see, which means that often people can read their books, can use their phone, can have a conversation with somebody without it really making any difference, which can make it quite hard to notice in its earlier stages. The really tricky thing with glaucoma, though, is that any sight loss that people have developed because of the disease is irreversible. We can't get it back. So it's really, really important that we're picking glaucoma up as early as we can so that we can start trying to halt or slow down that damage.
And why are we focusing on African and Caribbean communities specifically, Robin?
Yeah, so the Eye Health for All project is specifically looking at African Caribbean communities because they're at much higher risk of developing glaucoma than white European people. It's thought that the risk is about up to 4 times more likely to develop glaucoma than those white European people living within the UK. And not only are they higher risk of developing the disease, but they're also more likely to develop glaucoma at a younger age, and it's more likely to develop more quickly. But it's really important through this project that we are making people aware that it is something we need to be taking seriously at a younger age as well, and kind of getting into those routines of going and having our eyes checked regularly from a younger age.
And in terms of prevention, can we stop ourselves from getting this?
The short answer is that you can't, but I guess the slightly longer answer to that is having a diagnosis of glaucoma doesn't have to mean inevitable sight loss. So, although we can't stop ourselves getting glaucoma, there are lots of things that we can do to help us preserve our sight and keep our sight. We're really, really fortunate in the UK. We've got lots of different treatments available to us that can stop or significantly slow down any sight loss from glaucoma. And the earlier glaucoma is diagnosed, the more effective those treatments are, the better those treatments are at slowing down any sight loss from glaucoma. So although we're not able to stop ourselves from getting it, we can treat it and we can keep useful sight for life, even if we do have a diagnosis of glaucoma.
And Chuck Wadike, if I could bring yourself in, please, could you talk a little bit about how this condition has affected your father's and also your family's lives?
Hi, Barry. Thanks for having me. So, in terms of how it has impacted me and my family, first and foremost, when this happened, my father eventually lost his sight and he began staying indoors the more. So, a lot of things he was able to do on his own before that time, he wasn't able to do them anymore. For instance, he was always going to places riding his bike, but when he eventually lost his sight, he wasn't able to do any of that. And it impacted me hugely because I had to do a kind of readjustment in how I go about my daily life, knowing that he was home and that there are certain things he couldn't do on his own. Always want to input him in my daily plans, and as some of my siblings as well who were home at that time was also impacted because they know that they also need to include him because there are certain things he wasn't able to do on his own anymore.
And is there anything that could have helped your father's vision?
Yeah, like Robin mentioned earlier, I felt like if we had early information about glaucoma, like I said, It was when we went for like, an eye check that I first heard about it. And knowing that African Caribbean communities are like very prone to having this illness, if we had had this earlier information, maybe it would have probably helped my father to know that he has to go for regular eye check, maybe from his earlier years. So I felt like the lack of information and lack of communities and organizations working around this area in my home country in Nigeria was something that's really hugely impacted my father's sight. I feel like this would have made a major difference if we had period information, or if we had like access to organizations like Glaucoma UK who are working within this area back in my home country. But unfortunately, there was really like none at that time.
And Robin, is blindness inevitable if you are diagnosed with glaucoma?
No, no, it's not, is the honest answer. So, left untreated, some people will lose significant vision from glaucoma to what we would recognize as going blind, but not everybody will. I think that's really important to say. And also, we have got lots of different treatments in the UK. So, we've got eye drops, we've got laser procedures, we've got different surgeries that can lower the eye pressure, which will either slow down or even halt any progression of glaucoma. Treatment for glaucoma is for life. We can't cure glaucoma, we can't get rid of it. What we can do is we can slow down the rate of sight loss that people experience when they have glaucoma.
And final question to yourself, Chuck Wadike. What would be your message for people who might be at higher risk of getting glaucoma?
My message for them would be to be vibrant in going for regular eye check, and also joining communities as well is something that I would also advise, because joining communities will actually help you realize that you're not the only one facing this issue, and you also have a kind of support systems. These are like the two things I would recommend: regular eye check and then joining communities.
And if anyone has any concerns or queries about glaucoma, you can get in touch with Glaucoma UK by visiting glaucoma.uk. Well, listen, it's been a pleasure talking to you. Thanks for sharing the story about your father's vision. Chuck Wadike and Robin Asprey, Development Manager from the Sport Services team at Glaucoma UK. Thanks very much for your time on RNIB Connect Radio.
Thanks ever so much.
Thanks, Barry.
Eye Health for All is a pilot project launched by Glaucoma UK to raise awareness of glaucoma in African Caribbean communities and encourage regular eye testing. This initiative is built on the recognition that individuals from these communities are up to 4 times more likely to develop glaucoma than those from white European background. To tell us more about this, I'm joined by Robin Asprey, Development Manager Outreach Services from the Support Services team at Glaucoma UK, and Chigureki Yukoji, who is also with me now as well. Hello to you both. Good morning.
Good morning.
Hello, hi there. Thank you both very much indeed for your time today. Robin, if I may start with you, can you just basically describe what is glaucoma?
Absolutely, yeah. So glaucoma is a group of eye diseases that's actually the number one cause of preventable sight loss worldwide. So it is one of those eye diseases that we want to be taking quite seriously. Glaucoma damages the optic nerve, which is the part of the eye at the back of the eye that carries information from our eye when we're seeing to our brain. And that damage is usually caused by high pressure inside the eyeball itself. One of the challenges with glaucoma is that it usually affects people's peripheral vision first. That's the vision around the edges of what we're seeing, which can make it tricky to notice if we're losing some of that vision, because we can still do lots of things that we would usually do reasonably easily. We can still use our computers, read our books, do our crafts, use our phones, all of those kind of things without it making a huge impact. But any sight that is lost from glaucoma is irreversible. We're not able to get that back. So as glaucoma progresses, more sight may be lost, and therefore the impacts of that become greater.
Why are we focusing on African Caribbean communities particularly?
The reason that Eye Health for All is focusing on African and Caribbean communities is that evidence has shown that those communities are up to 4 times more likely to develop glaucoma than white European people. Not only are they more likely to develop glaucoma, but they're more likely to develop it at a younger age, and that glaucoma is more likely to progress more quickly. Quite often people will think of glaucoma as a disease that older people get, but it's not uncommon for African and Caribbean communities to develop glaucoma in kind of 20s, 30s, 40s. And we think it's really important that people are able to make their own decisions about their own eye health by being given this information, and then making some informed choices about their own risk.
How can I stop myself from getting glaucoma?
The slightly tricky thing is that the short answer is that we can't. If a person is going to develop glaucoma, there's very, very little that we can do to stop that. What we can do, though, is we can be proactive at looking after our eye health. So I mentioned before that it's tricky to spot the signs of early glaucoma, but they can be picked up quite easily at a routine eye test at the high street opticians. So lots of people think that going and getting your eyes tested at the opticians is just to see whether or not you need glasses, but they're actually checking for lots and lots of different things, including the health of your eyes. And some of those tests that they do at the opticians can pick up the signs of glaucoma, which means that we can diagnose glaucoma much, much earlier now than we used to be able to, and certainly long before people notice those changes to their vision. So if we've got an early diagnosis of glaucoma, we have lots of different treatments available which can either stop or slow down the rate at which people are losing sight from glaucoma, which means that people can keep useful vision and can keep good vision despite having a diagnosis of glaucoma. And that's what we want to make sure that people are aware of.
Okay, Robin, thank you very much indeed for that. If I may turn to Chuck Wodecki, if I may turn to you, thank you for your time as well this morning. How has glaucoma impacted your family?
Thank you very much, David. For myself, the first time I got to hear about the word glaucoma was sometime in 2013 when my father eyesight got deteriorated and we went in to see a doctor. And after the doctor performed some tests, he let us know that my dad was having late stage glaucoma and that he was eventually going to lose his sight. So that was when I began researching about the illness, and I realized that it has no known cure. It really got me worried at that time, and in terms of how the illness impacted my family and myself, the most important one is when my dad lost his sight, he began staying at home, and a lot of things he was used to doing by himself, he couldn't do them anymore. For example, he usually ride on his bike going around to his daily activities, but when his eyesight got very deteriorated, he wasn't able to do that anymore. So for myself, I would usually have to kind of readjust my life, my day-to-day activities rather, knowing that he was home and needed my help to do certain things. I would have to like plan a certain time I would need to be there for him. And this also was the case for some of my siblings. So it was a major readjustment in the way we lived our daily lives, knowing that he was depending on us for a lot of things that he couldn't do on his own anymore.
And is there anything that could have helped your father's vision that you're aware of?
Uh, I kind of felt like what would have helped his vision if we had earlier period information. Like I said, 20 when we went for the eye test was the first time I heard about the word glaucoma. But if we had a kind of period information before this time, perhaps organizations or communities who were working around this area back in my home country was pretty much absent during that time. Had it been we had a kind of medium to get to learn about this illness earlier and know that, okay, going for regular eye check would probably be a way to like notice this illness at its earlier stages. That would probably help it prevented my father from going totally blind with by glaucoma. So I felt like we really lacked awareness of this illness during that time. And this is also why I'm keen on trying to raise awareness as much as possible.
Is there any help or support that you would have been finding useful?
Yeah, pretty much the same thing with the last question. I felt like the lack of community as well and lack of organization working around this area who would have like provided help were pretty much absent. For instance, it was until I moved to the UK that I learned about organizations like Glaucoma UK, who are actually like doing a lot of work in the area of raising awareness and then trying to connect people with this illness and trying to like provide a kind of support. So I felt like there was a total absence of support. It was just me and my siblings trying to go through the whole thing alone. But Habibi, we had access to like organization working around this area that would have also like helped provided us a kind of guidance or counseling that would have really made a difference.
And Robin, if I may just turn back to you briefly, is it possible to go blind from glaucoma?
Yeah, absolutely. So as Chukwudike's kind of talked about, his father lost all of his vision from glaucoma, and this is absolutely the case for some people. If their glaucoma is not treated, then they absolutely can go blind. We are incredibly fortunate in the UK that we do have lots of different treatments available to treat glaucoma. But it's also really worth noting at that point as well that treatment for glaucoma is for life. We don't have a cure for glaucoma. One of the most common types of treatment for glaucoma are eye drops, and lots of people are used to um, having some kind of illness. They will take a course of antibiotics for a week or two, and then it's gone. It's been cured. They don't need to worry about it anymore. Glaucoma eye drops are much more like taking paracetamol, say, for chronic pain. The effects wear off over a period of time, and they do need to be put back in. So treatment has to be maintained. We have to keep going with it. We have to also keep going back to the hospital to check that those treatments are still working. So people might use drops for a number of years that control somebody's eye pressure and their glaucoma doesn't get any worse. And then the effectiveness of those drops might just start to wear off and they might need a laser procedure, for example. But because it's really difficult to notice those vision changes with glaucoma, we have to have those tests done at the hospital to check, because once we get further down the line, once we've lost more significant amounts of vision, we can't get that back. So we really need to be really diligent about taking treatments once we've got that diagnosis, and making sure those treatments are still working.
Okay, and Chuck Wadike, if I may turn to you once again, finally, what message would you have for people who might be at a higher risk of getting glaucoma?
Um, the message I will have for people who are higher risk of getting glaucoma would be for them to be very proactive, to go for regular eye check. Like Robin mentioned earlier, early detection is actually key to a kind of managing this illness. And if the only way to actually detect that is going for regular eye check. So I would encourage or recommend that people who are at higher risk of getting glaucoma should be vibrant in getting their eyes regularly checked. And secondly, it's also important to join or associate themselves with organizations that are working around this area. For example, Glaucoma UK, they can really be helpful in providing like information regarding the illness and maybe a kind of um like uh like advice or other stuff that would be very, very helpful. So it's probably my message would just be like they should try as much as possible to go for regular eye check and try joining communities and organizations working around this area.
Thank you both very much indeed, and I wish you a good weekend and a good week ahead. Thank you both very much.
Thank you.
Thank you.
So we're joined by Robin Asprey, who's the outreach manager for Glaucoma UK. Is that correct, Robin? Do you want to give you a correct full title?
Development. I'll put my teeth in. Development Manager for Outreach Services.
That's it. Thank you. Now, Robin, we're talking today about glaucoma and particularly raising awareness within the African Caribbean communities. And I know there's a couple of pilot projects, one of which is in Manchester. But first of all, please remind us briefly, what is glaucoma?
Glaucoma is a group of eye diseases, which is actually the #1 cause of preventable sight loss worldwide, which is one of the reasons why we're really keen to spread the word about it. It's an eye disease that damages the optic nerve. So the optic nerve is the back of the eye, the part that takes what we see and carries it to our brain. And usually when people have glaucoma, they have high pressure inside their eye, and that is what causes the damage to the optic nerve.
And why are you reaching out? Why is it important in particular to reach out to the African Caribbean community?
The reason we're looking at African Caribbean communities particularly is that they are at high risk of glaucoma. They're up to 4 times more likely to develop glaucoma than white European people are. But not only are they higher risk, but the evidence that we've got shows that they're more likely to develop glaucoma at a younger age, and that their glaucoma is likely to progress more quickly than white people who develop the condition, which is why we want to make sure that people are aware of their risk and then can, make informed choices about how they deal with that risk.
And what are the consequences if I mean, it's really important to get early detection, but what are the consequences if it goes untreated of glaucoma?
So if it's left untreated, people can go blind from glaucoma. One of the really big challenges with glaucoma is that in its early stages, at the time when it's most easily treatable, there aren't any symptoms. So people don't realise that they have glaucoma. The only way to be able to tell at that early stage is to attend a routine eye test at their optometrist, or just in the local high street, where not only will they check whether you need glasses to see clearly, but they'll also check the health of your eye. And when they're doing those checks for the health of your eye, they will be able to pick up that high pressure within the eye, and then treatment can be started before people are having any issues that are really obvious. It's glaucoma. Any sight loss from glaucoma can't be recovered. We cannot get sight back once it has gone, which is why we really want to be catching it as early as we can and kind of engaging in some of those treatments, which unfortunately is then a lifelong process, because once people have a diagnosis, we can't cure glaucoma, but we can slow down the progression, and we can either really, really slow down or stop sight loss that people might experience as a result of the disease.
Yeah, so it's really important to get that early diagnosis, and it's just a simple test that's done at the opticians as part of the routine eye test that you might go for. Is it always offered at the opticians, or do you have to specifically ask for it if you're worried or at a certain age? Or
Yeah, so as I said, people with an African or Caribbean background are more likely to develop it younger. So please don't wait until you hit a certain age to ask for anything. Pressure check is part of your routine eye test. They'll also have a little look at the health of the optic nerve at the back of the eye as part of your general eye test as well. If either of those things give any cause for concern, then they'll also do a visual field test, which they won't charge you extra for. But those 3 pieces of information together will give a very clear indication of whether they think somebody will have glaucoma or not. It's really important to say that from that point, they would then refer into the hospital system, because it needs treating in the hospital system rather than in the high street. But that's the place to go to get your kind of first early indications that something might need looking at.
okay, and now tell us about the pilot projects you've got running here in Manchester.
Yeah, so I've got a wonderful colleague called Peter who is delivering the project in Manchester. He's particularly focused in the Moss Side area, but can work in any areas of Manchester. And the way that we are delivering the project is we are working with local partner organisations. So he's been into schools and delivered assemblies. He's been into churches and joined congregations for their Sunday service. He's attended a homeless centre where they have a large number of African and Caribbean people that access support from there. He's working with a whole range of different community organisations to bring our message to where people are, because we know that people are very busy, people have a whole range of different priorities, and it's not reasonable to expect people to kind of be coming and seeking us out for this information. So yes, we're working with as many local partner organisations as we can to bring that message directly to people. So if anybody's listening to this and would like to work with us, please do get in touch. We're always on the lookout of new partners.
Brilliant. And that's that reaching out to the community to help tackle sort of health inequalities and things like that is really, really vital. And I'm really pleased that you're actually going out there to where people are, to engage with them and to raise an important issue of glaucoma. Thank you very much, Robin, for taking the time today to go through that. And I think we're going to hear some case studies as well on this about just exactly why it's important to get this test done. And it's so simple, and it's just a case of just making sure you have your eyes tested regularly. That's even if you don't have glasses, go and get your eyes tested regularly. That's the message, isn't it?
It is indeed. Yeah, absolutely.
Thanks again.
Thanks ever so much. Take care. Bye bye.
Thank you.